Hello, everyone, and welcome to the Who Do You Think You Are podcast. It is a psychology podcast. I'll be your host today. My name is Devyn Wickson. I am a student at Tulsa Community College. Finishing up my associate's degree. This will be one of my final projects. Today, we are going to be talking about addiction as a disease, why it is classified as a disease, what are some of the treatments for addiction, and what are some of the counter arguments against addiction being a disease. So, addiction is a disease. Alan Leshner wrote Addiction is a Brain Disease in 1997 and put forward a position that has been highly influential in guiding the efforts for researchers and resource allocation by funding agencies. He is quoted saying, "Addiction has embedded behavioral and social context aspects that are important parts of the disorder itself." That is a quote from Leshner, 1997. Um, And really, the way that it was viewed at that time, it met all the criteria for a disease, and it should be treated as such. And people that are suffering from addiction should have access to programs and insurance, health insurance that would cover the cost for getting that treatment taken care of. So, why is it a disease? Well, to modern medicine, E. Morton Jelinek pointed out a disease is simply a label that is agreed upon to describe a cluster of substantial, deteriorating changes in the structure or function of the human body and the accompanying deterioration in biopsychosocial functioning. And so basically, what that means is there are things that are happening to your body that are not normal because of a change of some sort or a disease. And it is also disrupting the way that you socially interact as well. And addiction does all of those things. Now, we will talk about later some of the different types of addiction or levels of addiction, rather, because not all substance use is automatically classified as substance use disorder or an addiction. But let's dive into how it is treated. So, Alcoholics Anonymous and Narcotics Anonymous are 12-step facilitation groups. Alcoholics Anonymous is focused on alcoholism. It is a peer-led and professionally led support group that is inviting to those suffering from alcoholism. You do not have to pay to get into these groups. They are completely free. There are donations that are taken at these meetings, and that is essentially to keep the meetings going. Narcotics Anonymous is a very similar support group. However, it invites all that are suffering from addiction, including those suffering from alcoholism, rather than the central focus of alcohol. That is Alcoholics Anonymous. So the main difference between Narcotics Anonymous and Alcoholics Anonymous is that we're focusing on addiction as a whole. Anybody that's suffering from addiction can attend Narcotics Anonymous, and for the most part, I think they have similar rules within the group. So you're not really supposed to, you know, describe your time with your substance use in the sense of bragging or thinking of the glory days. Um, and especially in Narcotics Anonymous, they don't want to separate being an alcoholic from being an addict. And so there's a common understanding of, whenever you are going to speak, you would say, or for instance, I would say, "Hello, my name is Devin, and I am an addict." Now, if I was in Alcoholics Anonymous, I would say, "Hello, my name is Devin, and I'm an alcoholic." So those are just two minor differences within those groups, but the central thing that they share is they focus on the 12 steps. And the 12 steps were initially created from the Bible. Um, it is a way that people can be accountable for their addictions, how they can not only forgive themselves, but to make amends with other people, and how they can prevent addiction in the future. These meetings happen every day at various locations, and they are, like I said, inviting to everyone. And so you don't need any insurance or anything to get into these groups. And they are very effective. In a recent study, there's a high quality of evidence that manualized AA meetings and 12-step facilitation interventions are more effective than other established treatments, such as cognitive behavioral therapy, which to me was a little surprising to read, as I'm somebody that did suffer or do suffer from addiction, but I didn't use the 12-step program. I seen a therapist, and I still don't go to 12-step meetings. And instead, I've kind of made up my mind that I'm not going to be within that life, and I'm going to continue to pursue goals and take care of my family and things of that nature. But it states that AA meetings can be just as effective as cognitive behavioral therapy for increasing abstinence. Non-manualized AA and 12-step facilitation may perform as well as these other established treatments. Um, and AA is obviously better than no treatment at all. There are other ways, though. When I was in rehab in California, we talked about acupuncture. And the way that some of the counselors would talk about acupuncture was more in a way of like it was a rich people's way to battling addiction, but nonetheless, it is very much useful. Acupuncture is a holistic pain remedy that stimulates opioid peptide production and release in the central nervous system. Acupuncture has a bidirectional role in addressing drug addiction. It's facilitating recovery of homeostasis or biochemical balance in the central nervous system, which is making repairs to those that have battled with drug addiction. Oftentimes you hear about people going through withdrawals, they have tremors and things of that nature because that their body is not used to that substance being in their system any longer. And so it's having the opposite reaction of what happens whenever you are on that substance. So if it's relaxation and a gain of appetite, then the contrary to that would be disturbance and a loss of appetite. Acupuncture stimulates nerve pathways that travel from the peripheral nervous system to the central nervous system that cause endorphin release. And so I'm sure we've all potentially seen acupuncture treatments where they have these little needles within them. And that is basically piercing different parts of the skin where the peripheral nerve system endings are, and it stimulates um, the peripheral nervous system and the central nervous system by sending those signals through the central nervous system up into your brain. Now, acupuncture can not only treat pain, but it can treat opioid addiction by facilitating homeostasis from withdrawal. That's what we talked about earlier. And unfortunately, insurance coverage is slow in expanding to include complementary medical therapies, including acupuncture. This is important not only providing acupuncture to treat addiction, but also to treat chronic pain, which in turn could translate to preventing substance abuse and addiction. And I think a big reason for that is because obviously large pharmaceutical companies are going to want to sell their medicines. And it's much easier to prescribe a bottle of pills than it is to get someone to a treatment center where they can receive acupuncture. Um, And so, not to dive too much into conspiracies, but there is some questions and concerns in regards to the American medicine and pharmaceutical companies and their lobbying within government control. So, like I was saying earlier, addiction is subjective and it is on a scale. I have a quote here from a recent study that I was looking into. Um, And it says, with regard to disease course, we propose that viewing addiction as a chronic relapsing disease is appropriate for some populations and much less for others. And so basically what that means is, yes, addiction is a disease. However, in order to unfortunately be going through addiction as a disease, you are probably suffering tremendously or you are deeply into your addiction. This is not something that has just recently happened. This is years of substance abuse. Although addiction is a disease, it is important to understand that not everyone using drugs, alcohol, and/or participating in other addictive behaviors are suffering from a brain disease. There may be fewer people that are truly diseased of the mind from addiction. Addiction typically occurs from risky drug use to substance use disorder and then being active in addiction. Characteristics of full-blown addiction are typically visible in character. Um, Whenever someone is severely addicted to something, it can be easy to spot because it's taken over their life. And whether that's, drug use, alcohol use, gambling, or pornography, or even other substances, one might start to ask to borrow money, or they start stealing from people, or just acting out of character to meet the needs of their addiction in general, ignoring their responsibilities to meet their needs. So they're prioritizing this addiction over almost anything else that's going on in their life. And sometimes that can, be losing jobs. That could be losing family or being incarcerated because of your addiction. Focusing all of their energy on that addiction. Now, a lot of people will say, well, addiction isn't a disease, it is a choice. Addiction is a compulsive act rather than a actual brain disease because there's no lesions of the brain or there's no specific areas of the brain that have to be treated in order to solve that disease. However, there are many other things that we consider a disease that also do not have brain lesions or um, effects to that nature. So we look at hypnosis as a treatment for addiction, because if it is all in the mind, then we can hypnotize ourselves and fix it all right away. If addiction were truly mind over matter, then maybe we can eliminate addiction from the mind and forget we ever were addicted in the first place. Hypnosis treatment is intended to act on underlying impulses to weaken the desire to smoke or strengthen the will to stop. Now that comes from a recent study from the Cochrane Library. I say recent, it's within the past 6 years, I believe. Um, and basically, what they were trying to do is they were reviewing these research articles that often had a lot of biases within them, unfortunately. And the bias was for hypnosis working for smoking cessation. Um, but there was one study that was shown to have little bias, but there wasn't strong enough evidence within that study to say that hypnosis is effective to stop smoking. Now, I think a big part of treating addiction is the willingness to complete your treatment. And um, I think that if it were so easy within the mind to just say, I'm done, then it wouldn't be as big of a problem. I think that it's a pretty simple choice to say, this is bad for me, I'm going to do something else. But it's not so simple. And I want to draw our attention to why that may be. Um, so addiction can occur from predisposition through your genetics, but um, it's more heavily on the environment that you're in. And so environmental factors are typically the strongest reason for addiction development, but it should not go unnoticed that genetic predisposition to addiction is legitimate. I want to take a look at this rat study where rats were used to study addictive behavior on a small scale, where they were isolated and basically just given a few options like food, water, or the drug. And oftentimes they would get addicted to the drugs. But it is important to note that just because rats act this way does not necessarily mean that humans will act in the same way. Obviously, there are various differences between rats and humans. However, it is favorable to say that there is there's substance to the rat study, as it has legitimacy that can produce more studies. So mice were basically given the drugs in isolation and they developed addictions. However, when the mice were paired with other mice, they were less likely to use substances and instead were more apt to focus on the food and sugars that were available as well as social interaction. The conclusion of this study was that rats and mice were less likely to self-administer drugs if they had access to social connection. And I think much is the same for humans. So a big part of my story with addiction was I was battling some mental issues from a young age up until my mid 20s, and I'd never really dealt with those things. And whenever I went and accepted that I was going to rehab, that I had to do it for court, I said I was going to take it all in for everything that it's worth and try to listen and try to participate the best that I could. Well, I seen a therapist while I was in there, And I was able to work through a lot of trauma, talk to somebody that has professional experience as well. On top of that, learning what addiction looks like, how it talks to you, and how it can control you in a chemical way, including your habits. And then from there, I was able to make those changes to sustain sobriety. And to this day, I'm 3.5 years sober. This is part of the reason why I'm studying psychology, is to help others get to that point where, if they want to use a 12-step program, they absolutely can do that, but also that there are other ways that the 12-step program or religious programs are not for them. I think that there are underlying factors that have to do with addiction, and especially in the way that it is treated. Every single person has individual needs, and those needs should be taken seriously. So that's going to conclude our podcast for today. We have reached about 16 minutes of yapping. Um, and I just want to thank all of my educators that have gotten me to this point. And I hope you enjoy the podcast. Have a good day.